Welcome back, everybody. I hope your Monday morning is off to a great start here this morning. We have another wonderful guest joining us, Amanda Grassley with Grand JiVante.
Yes.
You always have some wonderful information to share regarding seniors and things that we want to kind of look out for. And today I know you want to talk about kind of focusing on rehab care for seniors.
Yes, so skilled stays. And what type of patients or population this is geared towards. Most people, when they think skilled rehab, they think, oh, joint replacements, that type of stuff. And it's not just that. It could be, you know, if you're really sick with influenza or you had a stroke or were in the hospital for a long time and you just need some strengthening before you can be safe at home, that type of stuff. So really, your doctor will be able to say, you know, I don't think it's safe to go home yet. Maybe you need a couple weeks of therapy to get strong and be safe in your home, and they can determine that for you. And in the hospital, you will work with a social worker or case manager to decide your best route and plan of care outside of the hospital.
Okay. Let's talk about the benefits of doing something like this. So you're not necessarily continuing to stay in a hospital. Why would it be beneficial to go and enjoy some time at Grand JiVante?
So everyone wants to go home after a hospital. No one wants to go anywhere else. Your goal is to go home. However, you don't want to go home and end up back in the hospital.
Correct.
So one of the big benefits of skilled care is the strengthening. You will get physical therapy, occupational therapy, speech therapy, whatever you need, so you will be safe in your own home. And then before you are discharged from the therapy program, that therapist does what they call a home visit to assess your house, see if you have steps, you know, kind of what your normal day looks like at home, to make sure that you are able to do those things safely at home before we send you home.
So walk us through kind of what that process looks like for maybe choosing a facility and what, you know, do they need to have the referral and maybe some things to look for as a patient?
One of the main confusing things is you're in a hospital. Let's say you're in a hospital for a week and you're ready to go home. They're like, okay, well, we want you to go, you know, somewhere skilled. Well, then you have to know, were you admitted inpatient or observation? And the biggest difference between those two is if you are admitted as an inpatient, it just means you have something serious going on. You kind of need an extra level of care, where if you're observation, the doctor's kind of like, we know what's going on, but we're not too sure. So in order for Medicare to cover your skilled stay, you would need 3 nights as an inpatient. And the social workers and case managers know that you need that, and they will make sure that you have that before they find a facility. And if you have a facility that you know you want to go to, share that with them. Tell them where you want to go. If you don't know, they will find one for you and get you all set up, and the doctor will relay everything he wants done at that skilled facility, so that way you can be safe going home.
Is it something like, if you know somebody is going to be having a procedure and you know there's going to be some rehab time, maybe, you know, kind of doing some of that legwork ahead of time and going and touring some of these places? Most
certainly. So especially with like joint replacements, you know, surgeries that you know are coming, and the doctor can say you will need a rehab skilled stay to get strong. Then you can search out that facility, you know, let them know you're coming, the doctors know you're going there, and your care is all set up, and we are completely ready for you after your hospital stay.
So what does that skilled care look like at Grand JiVante?
We have in-house therapists, and it kind of depends on what you're there for, how much time a day is devoted to therapy, and really how much you can do. Your first day back from the hospital, depending on what you had done, you know, maybe you can only do a half hour of therapy, and then you are just wiped out, tired, sore. And then we'll work our way up to get you to up to 3 hours of therapy a day. Not all at once, but like broken down in little chunks, and it might be different. You know, physical therapy is more physical, making sure, you know, you can move, bend, step upstairs, where occupational is more like fine-tuned towards if you had a stroke, making sure you can feed yourself, open a box of cereal, kind of get things ready for yourself at home. So that's kind of what your day would be like. And I will say, pain will be part of the process. I mean, especially if you had a joint replacement. So you never want to refuse therapy. You know, let them know you're hurting, and maybe they can pre-medicate you before your therapy, because if you start to refuse the therapy, then insurance will say you're not doing anything, and then they could you know, stop your coverage and kick you out. And
it's something you want to do.
Right, you want to do it. It's going to hurt, and you just have to go in knowing it's going to hurt and deal with it. No, eventually it won't hurt.
So it's all about the recovery. Is there a general time period that this would fall in, or is it a little bit individualized for each person?
It's a little bit individualized, like I said, depending on what's going on. If you had a very serious stroke and lost like part of function on one half of your body, you're going to take some recovery time, where if it's your knee, I mean, maybe you'll just be in there 4 weeks, just getting strong. So again, it just depends really on what you're in there for the stay, and they will not send you home until they think you're ready, because they will do that home visit, and if they decide at the home visit like, oh, this isn't going to work yet.
I was going to say, what if a patient isn't ready to go home? You know, it's like you've passed through your therapy, but you're not quite ready to go home.
And that's a whole other thing where you would, if the facility is saying, you know, you've plateaued, there's nothing more we can do, but you still don't feel safe at home, then you would want to talk to your social worker, case manager, and say, you know, what can I do? Because you can always appeal the discharge and try to stay there a little bit longer and give them your case as to why you want to stay.
Okay. Are patients able to rely on this more than one time per year, or is there a limited number of opportunities
I know.
for this?
It is also technical. So let's say you come to Grand JiVante for a week skilled stay. You're doing good, you're rocking it, we send you home. Well, then a couple of weeks later you were like, I really don't think I should be home, can I come back? If you are within that 30-day window of your skilled stay, you're good. If you're outside of the window, you're going to need another qualifying hospital stay to get it covered. So it just kind of depends. Yeah, it's also technical.
It can be very technical. That's why we're having these conversations and knowing who to talk to so you can be in the right place possible. So let's kind of give overall thoughts of doing rehab in a long-term care facility, the benefits of that, and especially over at Grand JiVante, why they would want to come and check your place out.
So everything is at our facility. We have in-house therapists from the morning till the evening. I mean, constantly working with you, physical and occupational and speech therapy. If you can't get out of your room to go to therapy, they come to you. I also work over in assisted living, and the therapist will go over there to work with my assisted living tenants as well. And it's just all centralized. You don't have to leave the building. So when it's a blizzard outside, we are right there to work with them, get them strong, and have all of the equipment that we need in the building.
A lot more accessible.
Yes,
that way.
Very
more
much
accessible.
so.
And I love that you go and visit the home to make sure that it's as easy as a transition as possible, which is wonderful. And this is the kind of care and attention that you get when you are hanging out and staying at Grand JiVante. Amazing people here, a wonderful location. Remind everybody where you're located, and if they want to start this process, maybe they want to do a visit or see what it's all about, how can they do that now?
Yes, so we are in Ackley, which is just north on I-35 out of Des Moines, and then east on Highway 20. And if you think you want to come stay with us, certainly give us a call, and we can talk to you about your options and everything that needs to be done.
Very good. Very caring facility up there. And thank you for making the drive down last night. I know struggling on those snowy roads again.
It's winter now.
It's the effort they're willing to put in, no matter what, to make sure you get this information. And check them out on Facebook as well, because they're always posting some wonderful things that are happening at their facility to truly get an inside look of what it's all about. So thank you for joining us today. Great work as always.